economics and outcomes. Yeah. So first of all, I would like to thank you each and everyone for joining the session here today. Uh, so, so let's get started with the topic. Our topic is health economics and outcomes research, and we have agenda which includes few things to be discussed. So before we're moving on to the agenda. I would like to give you a brief explanation, like a brief overview on the on HEOR. What is I mean, what's the importance of HEOR, and then why HEOR compared to the other domains like such as clinical data management and pharmacovigilance, etc., etc. So I would like to give you a brief importance on the health economics and outcomes research, which is also simply called as a HEOR. So uh, basically, health economics and outcomes is it's completely related to the secondary research, which means in secondary research I mean we usually making the publications of articles and making making report submissions to the some pharmaceutical organizations or any or else and to country some country related agencies like regulatory bodies or regulatory agencies such as health technology assessments would be there, right? So in secondary research, we usually do the work is making a publications. That publications could be like what like like clinical trials, real world studies, any economic analysis publications, and any like treatment protocols or any clinical guidelines on the particular disease condition, and like some clinical guidelines and treatment guidelines also. So all of these publications, all of these things comes under in secondary research. In HUR we usually making the publications all of these documents, and along with that we make the proposal submissions for the country regulatory agencies. So basically, like health economics, health HEOR has a very important, very significant role in the domain, like in the field of healthcare. In the field of healthcare for various reasons. Those various reasons would be like such as in economic analysis of interventions and making informed decision about individuals' patient health and healthcare, and along with that we also like providing a better patient quality of life in the patient centered research, and also like this HEOR evidence, this HEOR it impacts some policymakers are making sorry. Yeah. uh yeah. If you feel any queries in the I mean while I was explaining, please interrupt me. I'm very happy to answer your queries. Yeah, thank you. Yeah, so HEOR plays a very significant role in healthcare field for various reasons. So those various reasons could be like economic analysis of interventions and patient-centered research, which means after being administering interventions, how the patient's quality of life, whether the patient is satisfying with the treatment or not, and and these HEOR evidence, it also impacts the policymakers. Policymakers are nothing but like any government organizations, like any funding organizations, insurance companies. So basically, there is a scenario in which actually in our market there are few drugs, there are few treatments which are expensive in nature. So that those medicines which cannot that medicines the patients are unable to affordable, right? So in such scenario, if you generate HEOR evidence about those treatments, then that will be accessible to any like some pharmaceutical organizations, some insurance companies, or some country related regulatory agencies. Then they will have a look at it. They will have a look at the evidence, and they will offer some pricing and reimbursement process in order to purchase some very expensive medicines, for the in order to provide the better patient care. So that is the overall importance of health economics and outcomes research. Yeah, next slide please. Yeah, so this is the agenda. So these are the things we are going to be discussed in this session. So first we have the introduction to the HUR, and after that, what are the qualifications and skills required in order to pursue our career in the HUR domain, and what would be the career growth in the HUR domain, and after that, syllabus. like what is the HEOR syllabus, and we have captured many important topics for you. And definitely we'll take you all through those important topics, and we'll give the information, much more information in detail about the each and every topic. And then after that, we'll discuss about our training program, which is RISE trainings, and what how the career programs in the RISE training. So this is overall our agenda for this session. Next slide, please. Next slide, Kiran. Yeah, thank you. Yeah. Yeah, if you look at this slide, this is the standard basic definition of HEOR. Basically, this is the combination of two terms: health economics and outcomes research. If you look at, first we look at the health economics, and after that we look at the outcomes research. So if you look at the health economics here, the name saying itself here, health economics, which means it evaluates the uh, economic aspects that relate to your health and healthcare interventions. For example, if you are suffering from any illness, so definitely you would visit a hospital, right? A hospital, like any healthcare unit. So you are going to spend some cost there for your, in order to get your healthcare interventions. So how much cost you are spending for your healthcare interventions? Then after that, after administering those interventions, we have to, evaluate like whether the treatment is providing desired effectiveness or not. So we have to evaluate the effectiveness of intervention, effect of interventions in various, in various ways we will evaluate, such as like in clinical outcomes, in humanistic outcomes, and economic outcomes. Let's say in clinical scenario, we usually evaluate the, like safety of the intervention and efficacy of the intervention, whether the drug is providing enough, enough effectiveness or not to the patient, whether the drug is reducing the side effects of the drug or not. We will evaluate these kind of outcomes in clinical analysis. And when it comes to the humanistic outcomes, in this humanistic analysis, we evaluate the patient's quality of life. Which means, after being treated with the treatment, how the patient's quality of life is there. Like, like whether the patient is able to perform his daily activities or not, whether the patient is satisfaction with the treatment, what he has been taken or not. So such kind of like a patient health status and patient's quality of life, we will evaluate such kind of outcomes in humanistic analysis. And next we have economic outcomes. As I said now, like how much cost you are going to spend on your healthcare interventions. So how much cost you are spending, based on that cost, how much benefits, how much effectiveness are you are getting from your intervention. So such kind of outcomes you will evaluate in the economic analysis. So this is the overall idea and the overall definition of health economics and outcomes research. Anyone has any doubt in this definition? What is HEOR? Please let me know. Yeah. Okay, fine. Thanks. Yeah. Next, we have sources of HEOR evidence. As I told you now, HEOR is nothing but a secondary research, which means a publication of articles, which includes like full length text articles and abstracts, posters, clinical treatment guidelines and protocols, and economic analysis papers and quality of life papers. So also all of these things are secondary research only. This is, we can call it simply, we can call it as a HEOR evidence. So these are, we have captured few sources from where we would get the HEOR evidence. So first, our clinical outcome assessments, and next patient reported outcomes, and next systematic reviews and meta-analysis, and from clinical trials and post-marketing studies and observational studies and real world evidence. Let's have a look at the clinical outcomes assessment. Basically, clinical outcomes assessments are nothing but those are tools actually. Those tools are completely depending upon the various type of disease condition. So based on the disease condition, the tools also will be vary. Yeah. So in clinical outcomes assessment, nothing but those are just tools which are used to evaluate the effect of intervention in the patient. Then after that, we evaluate the how much effectiveness is providing to that patient. So in these tools, basically we have two categories. First one is the patient reported outcomes and clinician reported outcomes. In patient reported outcomes, if you observe the patient reported outcomes here, it's talking about the patient health status after being treated with the treatment. here the patient is only giving responses. uh, Patient is only giving responses about his own health to the to the clinic, to the healthcare provider. So that is the patient reported outcomes. And next we have clinician reported outcomes, which means here the clinician is reporting, clinician is making the judgment about a particular patient health status. So like this, like like in patient reported analysis, patient usually gives responses about his own health. In clinicians make judgment about the patient health. Like like how do we evaluate that patient's quality of life and patient whether satisfied or not? How means there are few scales are there, and few questionnaires are available. Those are completely related to the some disease specific questionnaires and scales are there, and overall generic questionnaires and generic scales are available. Let's say, for example, a patient is suffering from a severe pain. So in that pain, in order to evaluate the what is the patient's quality of life of that patient after being treated with a particular drug, so we there is a scale which is available, which is a visual analog scale. This is a pain assessment scale. This is the pain assessment scale. So this scale comprises a range between 0 to 10. So so the lower score, which means it has a less severe. The higher score means which has a higher pain. So like this, some scales are available, which is overall generic, and some disease related scales are available. And next we have patient reported outcomes. Like as I told you now, like if patient is reporting about his own health, that is the patient reported outcomes. And next we have systematic reviews and meta-analysis. Basically, these are the some statistical procedures. Systematic reviews and meta-analysis. It's nothing but identifying, evaluating, and organizing the data that is completely related to your research area. For example, if you are going to conduct a research, so before you are going to conduct a research, you have to make a question, right? You have to make a question like on which topic you are going to perform a research. So systematic reviews and meta-analysis, these methods are it provides a published evidence that is completely related to your clinical your research topic. So these are the just methods to provide the evidence, all published evidence in an effective manner. And next we have clinical studies and post-marketing studies. Like as you all know, like clinical studies, the studies which evaluates the safety and efficacy of new drugs, and then we'll go through some trials phases, phase 1, phase 2, phase 3. So those are also from clinical studies reports, and from post-marketing studies also we will get some evidence about the particular intervention or about any particular disease condition. Next, coming to the real world evidence and observational studies. Observational studies is also called as a real world studies. Basically, these observational studies are simply, we can say, without any clinical trial involvement. Those studies we can call as a observational studies. It's also called as a real world studies. So what is the source of these studies? Like basically from the hospital records or any pharmacy records or any some patient registries and some hospital related databases would be there. So from those sources, we will get this evidence, HEOR evidence. And real world evidence, real world evidence is also like it's a medical evidence. But what's the difference between this real world evidence and observational studies? The main difference is real world evidence, this evidence we can directly capture from the patient throughout the from the patient, like from the date of patient joined in the hospital and till the date of patient leaving the hospital. So we completely follow the patients up throughout the patient journey, and will take the data from those patients. So this is the simple difference between real world evidence and observational studies. Yeah, I think someone has a query. Someone has raised a hand. I think someone has query. Okay, fine. No one. Perfect. Yeah, this is all about this slide. So next slide, please. Yeah. Yeah. So next slide we have, actually, why do we need this HEOR evidence? So the main, requirement of HEOR evidence is, for example, you're going to conduct a research. So before you're going to conduct research, you will select a topic, right? So if you select the topic, and then it helps us to find out, is there any research gaps are available, is there any still unmet needs are available in that research. Let me say an example. uh, for instance, you're going to you people are going to conduct a research project on a disease condition of non-small cell lung cancer. Okay, so you just simply go to you just simply go and visit some medical database, and you retrieve some published evidence. So eventually you would get around 100 articles, 100 publications. So you would go through all of these 100 publications by having a look at the title and abstract. So overall, I mean, at last, you would find out like 50 studies related to the clinical and safety and efficacy of the non-small cell lung cancer. And next 20 studies would be related to some quality of life of the NSCLC of patients, like non-small cell lung cancer of the patients. And remaining 30, maybe 20 studies are related to the economic aspects. And remaining 10 studies would be related to some diagnostic procedures of non-small cell lung cancer. So if you observe here, we have the more research evidence on safety and efficacy of the non-small cell lung cancer. Compared to that, we have lesser evidence related to the economic aspects and quality of life aspects of non-small cell lung cancer patients. And compared to this, we have very lesser evidence in diagnostic procedures of non-small cell lung cancer. So here we can consider as a here diagnostic procedures area, we have more scope to conduct a research again, right? I mean, this is a narrow space, this is a narrow research space. We have a chance to make it a broader on a diagnostic process of NSCLC. So that kind of evidence gaps we can easily find out on which topic you have been selected when you're conducting this any secondary research. So that's why we need HEOR. So that's why we need this HEOR evidence. We can simply find out the any gap evidence are there, evidences are there, like any still any unmet needs are there in that particular research. And next, we have this supplemental randomized control trial with real world evidence. For example, RCT is nothing but here randomized control trial. We can it's a clinical trial actually. So when you are conducting a clinical trial, you need to take care of few things like it has to be appropriate clinical trial setting, and the patient should be appropriate disease condition, and appropriate sampling method you have to use. Then only you could get the effective results at the end of the trial. Otherwise, you won't get the effective results at the end of the trial. Why? Because if you do not, I mean, if you do not follow some appropriate conditions in the trial, it will affect your results. It may cause some errors in your results. So in such, in such scenario, we have to prefer the RW evidence, real world evidence. In such scenarios, we prefer the real world evidence for the same disease condition. So, this kind of randomized control trials we can find out, and we can further develop the real world evidence projects for the same research topic. So, yeah, next we this HEOR evidence easily find out. It helps us to evaluate the cost containment strategies. Cost containment strategies are nothing but actually there are four: cost minimization analysis, cost benefit analysis, cost effectiveness analysis, and cost utility analysis. So all of these analyses will explain to us like reducing the healthcare cost for the patient and providing the better patient care for the patient in a healthcare unit. So this is this is the main motto of these cost containment strategies, which means reducing the cost burden to the patients in order to maintain improve the patient quality of care in the healthcare unit. Next, we have the promoting patient-centered research. Like as I said you earlier, providing the better patient health care and evaluates the patient's quality of life in a healthcare. So it promotes the patient-centered research, and it also whatever the HEOR evidence we have, it has to be comply with the HTA submission. HTA is nothing but health technology assessment. Actually, these are health technology assessment or agencies. So every country has its agencies, like nothing but regulatory bodies. So we have to align with whatever the publication we will do. It has to be aligned with it has to be comply with the our country specific country related HTA submissions as a and next we have yeah, I mean addressing evidence gaps in our research and respond to changes in market environment. Yeah, if you remember that post marketing surveillance, so even after drug has been approved into the market, still we will evaluate the drug, we will evaluate the drug safety and efficacy in a real world scenario. So, I mean, if you find out any like any rare side effects which did not appear in the clinical trials, then we can there is a chance to make some changes in the market for that drug. So we can find out that we can find out that kind of scenarios by using this HEOR evidence. And next we have adaptive adaptability data to the different population. For example, we have different regions in our globally. We have different regions like Asian subgroup, like and some US subgroup, European subgroup, and African American subgroup. So we have different group subgroup regions there. So based on the different subgroup regions, we have the outcomes. You know, the outcomes would be vary. So that's why the data has to be different population, like different racism population, so that we can find out that kind of evidence. So for example, Asian subgroup population, we have different, we may see the different results in a same disease condition. And in Europe also, we can see varying the results in the same disease condition, because their lifestyle is different, right? So in such scenario, these kind of scenarios we can easily find out from the HEOR evidence. Yeah, this is all about this slide. So that's why, so in order to find out all of these things, we need HEOR evidence. We require HEOR. Yeah, thank you. Yeah, in this slide, I mean, who needs HEOR evidence actually? Of course, I think everyone needs this. Everyone has to possess some knowledge about, right, about the interventions and what is the patient condition. So after being treated with the particular treatment, how is the patient's quality of life is, how the patient's quality of life is going to be. So, and then what kind of precautions to be taken, what kind of care we have to be provide them. So everyone needs this HEOR evidence. Everyone needs HEOR this knowledge, like own decision health makers, any organizations, country related regulatory agencies, in government hospital people, and physicians, healthcare professionals, and even patients, pharmacies. So everyone needs this. Everyone has to possess this HEOR knowledge. Then only we can make the then only we can make an informed decision about a particular disease condition to provide the better outcomes to a patient. Yeah, this is all about this slide. It's just, yeah. Next, coming to the qualifications and certifications. So if you want to pursue your career in the domain of health economics and outcomes research, so you have to be mastered. You have to be mastered in the degree of some life sciences and epidemiology, and masters in pharmacy, and like masters in health economics and economics also there. So you have to be mastered with the life sciences, any life sciences group. And also along with that, you have to be in doctors in philosophy. That is also is completely related to the science background. And some medical sciences also, like BBS students and dental students also are eligible into this domain to pursue their career in HEOR. And along with that, so we can make some certifications. So some courses are available on their online. So some universities, some deemed universities are there, Public Health Foundation of India and Manipal Academy of Higher Education. So some, I mean, these deemed universities are providing some courses online. So if you have a chance, please take please enroll into those courses and get a certification from those universities. Definitely it will be helpful for your professional career growth. And along with that, I mean, along with this the scientific knowledge, you can also have to possess with the some like technical stuff, like like programming, any Microsoft schools, Microsoft tools, and some medical writing also. I think this technical knowledge is completely requires in a higher level. For the entry level or for the fresher, these technical skills does not much require. Yeah, this is all about qualifications and certifications. Yeah, so these are the skills we must equipped with these are skills we must equipped with. So we have research skills and technical skills. So as I said you, like research skills like some epidemiological studies, like systematic reviews and meta-analysis, writing any scientific reports, having knowledge on scientific life sciences. And coming to the technical skills like MS Office tools, Excel, Word, PowerPoint, and some databases and search engines also like Google. Some medical databases are there like Cochrane, Vovi databases are there, PubMed. PubMed is freely available on Google, so you can directly access into that. If you get a chance, please access to that and have a look at that and play around with that PubMed. Like how do we conduct search from the PubMed? How do we retrieve the articles which are related to our research? And coming to reference tools, so we have EndNote and Mendeley. EndNote is very much important for referencing. So please take any course on the reference tools. EndNote is I think EndNote is very good. Yeah. Yeah. So this is the overall career overview in HEOR. So if you pursue your career in HEOR, so there are, I mean, there are some government organizations will be there to get a job, and some product-based organizations also there, some service-based organizations also there, and apart from the colleges and companies, I mean, apart from these organizations and private organizations and government organizations, we also have some colleges. So academic groups and collaboration. Some colleges are big collaborating with some organizations will be there like Cochrane and ISPOR will be there, and some HTA agencies. So some colleges are collaborating with these organizations, Cochrane, HTA agencies, and ISPOR, and some other HTA agencies. So in that also you are able to get job in that academics groups. Yeah, so this is the entire hierarchy level of position in HEOR. So if you, for example, if you get a job in a HEOR, so first you will be recruiting as an intern or analyst. Maybe it completely relying on the company or organization, which organization you are going to. So some companies maybe you can some companies taking will taken as a intern or analyst, and then after that associate consultant, and then it leads to consultant and senior consultant, and after that manager, associate director, director, senior director, executive director. So this is the hierarchy level of position of HUR role. And next this is the package, like package. This is the average, like this is the median package range from 3.5 to 7.5 lakhs per annum as a fresher and entry level, with the value of 5.5 lakhs per annum. Oh yeah. So here, I mean, this is the syllabus what we have. So these are all the topics. These are very, very important topics. So definitely, we will take you all through these topics, each and every topics in detail. So first, we will be starting with the drug discovery and development, and after that, we'll just give you the brief introduction of some terminology which is used in health economics. Then only, so once you get adaptability to the terminology, the further topics also you can easily get adapt to the topics. uh, Next, research methodology and study designs, and next systematic literature reviews and meta-analysis also would be there. And how do we conduct systematic literature reviews? Basically, in every organizations, basically we do work is systematic literature reviews and meta-analysis only. Definitely we will explain to you like how do we conduct this systematic literature review, what are the steps to be taken if you want to conduct a systematic literature review, steps involved in systematic literature review, and some quality assessment tools also would be there, and economic evaluations, like some epidemiology terms and humanistic outcomes, treatment patterns, some basic biostatistics is also very much important in health economics and outcomes research for the statistical analysis. So definitely we will provide the information on basic biostatistics. And next provides and we'll provide Word document which contains all the basic questions, like for the interview, for the sake of interview. We will give some guides and materials for the interview purpose, and after that we'll also take some mock interviews and some written test assignments also for your interviews purpose. So this is the entire syllabus what you will be going through in the next coming days. Next slide. Yeah. So here we have captured major companies list. In these companies, I mean, in these companies is holding these health economics and outcomes research. So these are all the India-based companies. I mean, basically these are all multinational companies only. But in India, these are all the companies available in India also. Eli Lilly, Novartis, Paraxel, IQVIA, Lumanity, Sanofi, Cheers, Icon PLC, Syneos Health, Eversana, Ridge Medical Consultancy, Novo Nordisk, ZS Associates, Sandoz, EBM Health, Clarivate, PPD, Connect HEOR, Pharma Edge, Trinity Life Sciences, WNS Global, Smart Analyst, and Extria, Marksman Healthcare, Molecular Connections, and Ceratera. So these are all the list of companies you can easily access into the health economy HEOR domain. Yeah, next we have the fee structure. I think uh, this slide will be taken by Kiran. Over to you, Kiran.
Yeah, so am I audible? Hello.
Yes.
Yeah, so thank you, Prakash, for having an amazing insights about the HUR and having the brief explanation about the HUR. So coming to this slide, we are going to start second batch regarding the HUR in the next month starting. So coming to the first bullet point, so the course launch offer price will be the 15,000 rupees and actual or normal price is the 20,000 rupees. Next, can you go to the next slide? Yeah, coming to the placement details. So far, our students have been placed in so many MNC companies like all the Accenture, Epsar, and so many other MNC companies across the global. Next slide, please. So coming to the rise trainings, we do have the both the career launch program as well as the career growth program. So coming to the career launch program, basically it is for the freshers whoever have pursuing or complete the B form means graduation or post graduation. And coming to the career growth program, so whoever has experience over across any domain like CDM, vigilance, HU, irrespective of any domain. So we do have the career growth program as well for the experienced people. So you can contact to us regarding the course details of the HEOR. And I am dropping over here the Kiran sir mobile number, so you can ask him over the call, or else you can ask him over the WhatsApp as well. Yeah, so I have dropped his contact number over the chat box. We can have a look on it. So coming to the session, if anybody having any queries, so you can ask us. So we do have 5 more minutes to complete this session. So yeah, you can ask us regarding any queries about the HOR from slide 1 to end of the slide. You can ask us. So hope the session is very clear for everyone. If anyone having any queries from anyone, and you can ask us regarding HOR.
Even if you feel any queries after ending this session, just make a note of those and we'll discuss in the further sessions, or you can also post in our WhatsApp group.
Yes, yes,
Definitely we will answer there itself. Yeah.
yeah. So that's why I have dropped Kiran's contact number, so you
Yeah.
can contact him over the call, or else you can contact him over the WhatsApp as well regarding the course details, regarding the irrespective of any domain, you can ask him over there. And coming to the respective of the this section, you can ask any queries. So we are here to solve the queries only. So you guys have few more minutes to ask.
and make sure yourself to be joined in a WhatsApp group by asking Kiran. You don't forget that.
Yeah. So hope it's clear for everyone. I think we can end the session. So thank you everyone. Thanks for the joining. Thanks for the time as well. So thanks everyone. Thank you.